Hello, my name is Katie Jones and I am the reference librarian for the Bossier Parish Community College Library. In this video, we will look at how to find articles on allied health and medical topics on our online databases. So I am going to show a picture of our screen here. And the first thing we want to do is just get to the library's webpage. So we'll do that by hovering over Academic Life and then going down to Library. So that's Academic Life and Library. And that will bring us to our library webpage where we've got a lot of really helpful information here for you. But to find those databases, I'm going to hover over Databases and click on Databases by Subject. Now, if there's a specific database that you know and that you're familiar with, you can absolutely click Databases by Title and go straight to it. But for our purposes today, I like to stick to the Databases by Subject list. Now, luckily for you guys, Allied Health is the first list here in our subject list. So I'm going to click on Allied Health, and then it's going to bring me to a list of all of the databases we have that have any information on allied health and medical topics. I'm probably only going to discuss a couple of these today, but I do want you to know that there's a wealth of information in our databases available to you. So the first one I want to click on is this CINHAL Plus with full text. And when I click on the name of this database, if I was off campus, it would ask me to log on with my Lola username and my 6-digit birthday as the PIN number. So if you are off campus, once you prove that you are affiliated with BPCC, you can have access to all of this information that we look at from this point forward. Now I'm going to go ahead and make this full screen so that you can have a better look of what this database looks like. Now you'll notice that it has select a field options. You can, for the most part, ignore this unless you know the exact author of an article you're looking for or the title, or maybe you only want to find information from one particular journal. This will, if you just leave it blank, it will look at the entire record and pull up anything that ever mentions whatever you put in this box. So if you feel comfortable using these options to narrow down your search, please feel free to do so. But if you don't select anything, it will still bring you some really great results. So for this example, I want to try and find articles on the link between vaccinations and autism. So I'm going to start first by just putting in the word vaccination. Notice that it's already trying to narrow down my results, but for our purposes, I'm just going to go ahead and click on this first one and search. And so the results came up with 6,157 articles on vaccination. Now, if I want to look at that link with autism, I'm going to add the term autism here. Whoop. Which means that it will take a look at all of the 6,000 results and then narrow it down to only the ones that mention autism. Now, I can already tell that this seems like a fairly low number. So one thing I might try is to change up my search terms a bit. Notice what happens when I change the word vaccination to just simply vaccine. And that added quite a few results for us. So I went from 38 to 134, which let me know that there was a better way to do that search. So don't feel like you can't change up your search terms, because often it works better if you try lots of different combinations of words to find the best results. And in this case, we have 134 articles mentioning both the word vaccine and autism. But I want to narrow that down a little further to the ones that would best work for an academic paper. The first thing I see is the publication date. It says here that our earliest article is from 1999. Well, if I'm doing a paper on a medical topic, I want the most up-to-date research. So what I want to do is I'm going to hold my mouse down on this little slider, and I'm going to bring this up to, let's say 2009. You can really choose whatever date you feel comfortable with, but I want to see what was written in the past 5 years on this topic. So that has narrowed it down to 33 articles written in the past 5 years with the term vaccine and autism. Another thing I might do is narrow it down by source type. It does look like 11 of these articles were written in magazines, but I really want to focus on academic journals and the most scholarly information I can find. So I'm going to click on academic journals, and it will narrow down anything that wasn't in one of these scholarly journals. So after this updates with my new revised results, it looks like I have 22 possible articles mentioning both vaccine and autism written in the past 5 years in scholarly academic journals. So this is going to be a really good set of results for my paper. And already I can tell just by glancing at some of these titles that these look like they could be some pretty good results. And in fact, I want to go ahead and click on this number 4. It says update on autism and vaccines. And here it tells me who wrote it. It tells their affiliation, and it says it's from the Journal of Psychosocial Nursing and Mental Health Services. So that tells me that does sound like a legitimate journal. And then here in the abstract, it tells us a good solid summary of what that article is going to cover. So once I've read through all of this, and it does look like that would be a good article for my paper, I'm going to go ahead and click on PDF full text. And that will bring up the article in its entirety. So this will be a scanned version of the way the article appeared in the journal, which means it will include any pictures or charts, as well as page numbers. And those page numbers will definitely be helpful when you want to cite what page you got your information from. So I like to click on the PDF just because that is going to be a nicer looking version of that article. I'm going to go back to the detailed record because we're going to take a look at these tools over here to the right. It will be the same tools. It will just say what they are. So for presentation purposes, it looks a little better if I go back to the detailed record. So with this article, I have lots of options with what I can do with it. I can print it. I generally recommend that you open up the PDF and print it from the PDF. Every now and then it will try and just print this page. So I know you probably want the actual article itself. Now remember that you do get 300 pages a month for free in the library, in the TRC and the TLC. So you can definitely use those pages to print out some of these journal articles. You also have an email option. You just put your email address in this second box once it kind of loads up for us. There we go. Put your email address here. It doesn't even have to be your BPCC email address, just whatever email you use most. You can even write yourself a little message to remind yourself what that article covers. Another very helpful thing about the email option is that it does give you the option of sending yourself the citation. Depending on what style your professor wants you to write in, you might need AMA, APA, or MLA. So say, for example, your professors asked you to write your paper in the American Medical Association style. You can click on AMA, and it will send you the AMA citation for that article in the body of your email. So that makes things a lot easier when it's time to make that works cited page. You also have the save option, so you can save it to your flash drive or to your desktop if you're at home. And then the cite option. I mentioned citations a second ago. This will show you the citation for this article in a variety of different styles. So depending on which citation your professor wants you to use, you can just scroll down to that citation and view what that looks like. Now I do want to give you my little disclaimer, and the database gives you the same disclaimer. These are computer generated, so there can be some mistakes sometimes. So definitely take the time to look at it, make sure it's exactly the way your professors asked you to do it, because there can sometimes be some discrepancies in capitalization or date. So again, that was CINHAL Plus with full text. I want to switch over now to another database. So I'm going to go back to that databases by subject page here in our bar. And this time I want to go to Proquest Nursing and Allied Health Source. This is another wonderful database. They have information specifically for medical professionals, so it often is written by doctors and nurses for doctors and nurses. So they'll take kind of a more scholarly look at the information. Now I want to click on the health and medical subject. So now we're just going to be looking at health and medical information. And let's say in this case, I'm looking for the most up-to-date information I can find on Ebola. So I'm going to put in the word Ebola and search. And we got 6,521 results on Ebola. Now, one thing I automatically realized that I didn't do is I didn't click this full text option. Full text means that it's going to give you the full article itself, not just a citation to the article. So if you want to make sure that you're going to actually get the content of the article, I would recommend going ahead and clicking full text. And while we're at it, we might as well also click peer reviewed. If you know that your article is peer reviewed, you know it's been vetted by a panel of experts in the field, and it's going to be the best information possible. So let's see what that does to our search. So now we're down to 1,794 results. Much less than we had before, but still a lot of possible sources for our paper. Now notice that they have related searches. So maybe I want to see if there's some sort of vaccine for Ebola, or maybe I want to see what the treatment is. They don't have an option for treatment, so I'm going to go ahead in this box and add and treatment. So maybe if I'm a nurse and I want to know how Ebola is treated, it's now going to narrow it down. Ooh, nope, don't want to do that right now. Narrow it down to those that mention both Ebola and treatment. So we've got 972 results. But right off the bat, I see an article of treatment of Ebola virus. Now this is a study in monkeys, so you might decide that that isn't exactly the direction you wanted to take. Maybe you want something for how to treat actual human patients. I can glance through some of these titles and see if any of these look like they could possibly work for my paper. But let's first narrow down those results like we did last time. Now remember, in the last database, it was to the left. This time, our refine the results options are to the right. So I'm going to go ahead and narrow it down by date first. Notice the huge jump in records around 2014 because that's when the Ebola outbreak first occurred, or in its current form. So I'm going to go ahead and say 2012. Let's see what's been written from 2012 onward. So I'll update it. That will narrow down quite a few of our results. And then I also want to make sure that I'm only looking at scholarly journals. So let's look at those scholarly journals. And so now I know I've got the most up-to-date information, the most scholarly information, and it is going to talk about both Ebola and treatment. So let's see here. I'm just glancing at some of these titles. I want to try and find one on human. So here it does say, physician pushes for improved Ebola care. So I want to take a look at that, see if that's kind of along the lines of what I was looking for. And in this case, it's going to give me an abstract or a good solid paragraph telling me what that article is about. And I've actually got this article in a couple different formats. I can read the full text version, which is all just typed out right here for me. Or I can view the PDF here under Other Formats. Click on that, and it'll bring up that PDF, which was a scanned version of the way it appeared in the journal. And this does look to be a lot cleaner and nicer looking than the full text version we were looking at before. So if you're a nurse or you are a medical professional and you're trying to find information of how to treat a patient or how to find research on some sort of disorder or disease, the databases are a really wonderful place to go. Just remember that you want the most scholarly information and you want the most up-to-date information. And as always, if you have any questions whatsoever, please come see us in the library. Thank you.